I'm Brittany Bingham. I'm the head athletic trainer for sport clubs here at CSUN. We have a very large population of participants here on campus. We have over 32 different sport clubs that we offer, upwards of 800 to 900 student athletes, participants. And so we cover everything from high risk to low risk, meaning rugby, boxing, jiu-jitsu, soccer, taekwondos, down to our more recreational sports, badminton, table tennis, some of our dancing teams, salsa libre, hip hop. And so because we have some of the widest coverage of sports from high to low risk, we see a lot of different injuries. We have a lot of participants that get injured and need that extra level of care with a competitive nature that not your general intramural sport athlete would need. With our higher risk sports, we have a lot of concussions, fractures, your generic muscle strains, joint sprains. We see a lot of ACLs, MCLs. We treat everything, obviously, but our most common ones we've been seeing lately have been concussions, muscle strains, and some sprains. The typical day starts with a clinical hours where we treat our athletes, evaluate new injuries, strength and conditioning, whatever needs to be done in clinic, and then we usually cover a practice or an event in the afternoon and evenings. I think that we are key and essential to the role of helping our athletes obtain the best that they can obtain. So whether that's strength and conditioning before an injury occurs to the injury itself and then prolonged care after the injury to get them back to return to play, I think that we are central to that and trying to coordinate their care even with outside physicians, outside PT clinics, or other allied health professionals. We actually have a very good relationship with the Student Health Center here on campus. They coordinate a lot of our care and help us oversight our program. We work with Dr. Slutton, who helps us with our policies and procedures, and then also utilize them for physicals, for general appointments, day-to-day care for all of our participants. So the fulfillment that I get from doing this the most is us being able to educate our students and being able to introduce to them and expand their knowledge in the care that we can provide for them as athletic trainers, what our role is and how to utilize this best. And the fact that we get to offer them something that not a lot of other universities have, and it's such a large, facility, the staffing that we have, what's available to them through our connections with the Student Health Center, we're able to take care of them on the level of an NCAA institution, and that's very rare for a sport club program.